So that one thing we will discuss with you today, we are starting the counting profile, right? Counting profile means I have already given you into the course outline. Here you can see that into the first portion there was the blood collection and hemoglobin estimation, and the second portion there was some coagulation related tests, right, like bt, ct, aptt, pt, and last one is the d-dimer. Hopefully yesterday and in the previous class we have discussed about the d-dimer, right? And now we will gradually discuss about the count. Count means we have to count in every blood cells. Firstly, whenever we are counting anything, we need to understand that which kind of blood cells are present. Say me, what are the blood cells are present into our body? That is too much easy. Say me. And after that, I will ask you the another question.
RBC, WBC platelets.
Got it? RBC, WBC platelet. And one thing just keep in mind that is there any kinds of variation of RBC? Yes or no? Is there any kinds of variation of RBC? Like there have lots of types of RBC. Is there any types of RBC or every RBC are same like same?
No, sir. No, sir.
Same like
Every RBCs are same.
very good. So that we will count only total red blood cell count. We don't need to count the differentiate red blood cell count. Have you ever listened this term differentiate red blood cell count? No, that is only total red blood cell count. Got it? And second thing is the platelet. Platelet is also same like structure. There are no types of platelet. There are no variation of platelet, right? Like neutrophil, eosinophil, there is no variation of platelet. So that we have to count the total platelet count. Got it? And last one is the total WBC count, and there is various type of WBC, right? There is basically 5 types of WBC. One is granulocyte. Into the granulocyte we can say that neutrophil, eosinophil, basophil, and under the agranulocyte there is basically lymphocyte and monocyte. Got it? So that we have to count the WBC in two way. Firstly, total leukocyte count or total WBC count, and second should be differentiate leukocyte count, or into the short form we are saying that DLC. Got it? Differentiate WBC count or differential leukocyte count. Got it? That's all are the profile related to count. Okay, we are dividing the hematology into various segments so that we can easily understand it properly. Okay, now before starting the class I just want to discuss with you the outline we what we are going to understand. Okay, it is important to know. Okay, firstly we will discuss about the introduction, what is RBC count and anything blah 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 things, and second thing should be what is the purpose, why we will do the RBC count. Thirdly, what are the methodology? There is various type of method I will discuss with you, don't worry. And last one should be the procedure, how to we count the RBC. And last but not the least, that is clinical significance. Clinical significance means if RBC become elevated, which kind of symptoms may occur? If RBC become decreases, which kind of symptoms may occur? Okay, we need to understand everything. Got it? Okay, see here. Firstly, what is total RBC count? That is a very basic things, but we need to understand from the basic to advanced. Okay, see here. Measures the total number of red blood cell in 1 microliter of blood. Got it? There have blood have the wide variation, so that we have to take in the RBC within 1 microliter of blood. Got it? Within 1 microliter, only within 1 microliter we have to count the red blood cell. Got it? After that, that is the normal ranges. We need to understand that 4.7 to 6.1 million per microliter. Million means 1 million means 10 lakh, right? Then you can understand how many RBC are present. Into the female, that is less, 4.2 to 5.4, because female hemoglobin is less, right? And last one is the children. Children is 4.1 to 5.5. Got it? Now, what are the function of RBC? See here, transport the oxygen with using the hemoglobin, because RBC contain hemoglobin, right? RBC contain hemoglobin. Hemoglobin is iron and protein, okay? Or we are saying that hemoglobin is the protein in nature, and outermost portion is that is called RBC. And during the presence of hemoglobin, the RBC's color is red. Got it? And there have also lots of type of RBC. Keep in mind that. But that is the abnormal condition. If RBC size become increases, that is called microcytic. Yes or no? If RBC size become decreases, that is called if RBC size become increases, that is called macrocytic. If RBC size become decreases, that is called microcytic. Okay, microcytic means size become decreases, macrocytic means size become increases. Okay, if the color is pale or if the color become decreases, that is called hypochromic. Got it? Or if the color become increases, or if the color is too much deep due to the presence of too much hemoglobin, that is called hyperchromic. Got it? Chromic means color. If it decreases, that is called hypochromic, or if it increases, that is called hyperchromic. Got it? And after that, that is the remove of carbon dioxide. That is also the function of RBC. Okay, now what are the purpose of red blood cell count? See here, diagnosis like anemia. Anemia means decrease of RBC. If RBC become decreases, that is also the bad condition. If RBC become increases, that is also bad condition. See here, polycythemia. And another one is the dehydration. Okay, and monitor the treatment process. Which kind of things? Anemia or chronic disease. If any kinds of chronic disease are happening, then we can easily measure the level of this chronic disease through the RBC count. Got it? So that doctor suggested the CBC, complete blood count, right? Into the complete blood count, we are getting the whole parameter. But for interview purpose, for manual purpose, for competitive exam purpose, we need to understand the every count manually, because the questions are occurring which kind of reagent we are using, the questions are occurring how the calculation are happening, the questions are occurring what are the procedure of manual methodology. Okay, they will not ask you the automated methodology. Now evaluate the overall oxygen carrying capacity of blood. Got it? That's all about the introduction of red blood cell count. Say me if anyone facing any problem. I think it's too much easy. Robiol, sometimes I see this one into my class. Robiol, are you listening me? No. Leave it. Everyone have any problem?
Hello, sir.
No, sir.
Okay.
Hello.
Robiul, from which study you are belonging?
বলছি sir. No, sir.
Gaur.
Hello.
Gaur, please note down your problem. Please note down your problem. I
হ্যাঁ,
will solve you. Say me.
ঠিক
Network issue. Note down your problem. I will solve you later. Okay. The class will be lengthy. We have to learn lots of things. Okay. See, method of measurement. How do we measure the red blood cell? Today is a very important class because we have to understand how the counting are occurring. It's important questions as well. Okay, see here. Basically, the test name is complete blood count. Into the complete blood count, we are getting the total RBC, total WBC, differentiate WBC, platelet count, red cell indices, that is a MCB, MCH, MCAC, PCV, RDW. Got it? And there was the first parameter was hemoglobin, right? And so that into the complete blood count, we can easily measure the RBC's level. Okay. See here, here is the first one is the manual method and second one is the automated method. Okay, through the manual method here require the hemocytometer, that is an important thing, and through the automated method here does not require any kinds of hemocytometer, they are required this kind of cell counter. Got it? That can be 3 parts or that can be 5 parts. Understand? Now I am discussing about the manual methodology. Okay, which kind of things are required? Firstly, required the hemocytometer, or we can say that Neuber counting chamber. Understand? Secondly, required the microscope. Thirdly, required the RBC diluting fluid or Hims fluid. Keep in mind that these questions are occurs too much. Which fluid we are using for RBC count or RBC diluting fluid's name? Understand, that is a Hims fluid. Hims fluid. Got it? And one pipette is required. Everything you will get into the hemocytometer tube, okay, or hemocytometer box. If you are just going to any shop and just purchasing these things, just you have to say that give me a hemocytometer, then they will provide you the hemocytometer that will be accompanied with everything. There will be Neuber count chamber, you have to purchase is anotherly, okay, and you will get everything. The pipette will be present there, okay. Say steps. Firstly, you have to dilute, dilution of the blood. Anyone can say me which file you have to take the blood? It's very much simple.
EDTA.
EDTA file. What are the full form of EDTA? Just 1 second.
Ethylene diamine tetraacetic acid.
Very good. See here. What will you do? You have to take 0.0 ml. It's a tough thing, right? We can say that 20 microliter of blood and mix it with 4 ml of RBC diluting fluid. How do you mix it? Through, you have to take just one, what can I say, one dish like structure. In every laboratory there is present, or you can take a beaker, or you can take a any glass materials, okay. Here you can mix up it, okay. Just take it, and what will you do? You have to just added 4 ml of diluting fluid, that is Hims fluid, that is commercially purchased. Don't require to formation it, or don't require to prepare it. You can just purchase it, Hims fluid, okay. And you have to add 20 microliter of red blood cell, or 20 microliter of blood here, okay. The keep in mind that the dilution should be 1 is to 200. Got it? Dilution should be 1 is to 200. This dilution is important to for any competitive exam, or for your board examination as well, for your interview as well. Which dilution we are using for the count of RBC, then you have to say that the dilution should be 1 is to 200. Got it? After that, whenever the dilution are happening, what will you do? You have to just fill the chamber with the diluting sample using a pipette, that is called RBC pipette. Got it? You have to just here you can see that here, see here, that is the RBC pipette, right? That is the RBC pipette, that is the RBC diluting fluid, okay. And after solving these things, or after explaining these things, I will go to then this PPT again, okay. That will be helpful for you guys, okay. See here, that is the RBC diluting fluid, right? That is the RBC pipette. Got it? And you will see for identifying or for differentiating into the RBC pipette, the pipette there will be present a red color dot, okay, and into the WBC pipette there will be white color dot. That might be present or that might not be present. That's depend upon company to company, okay. And after that, that is the Neuber counting chamber. Got it? What will you do? You have to just take the blood. Got it? Take the blood up to 101 marking, okay. No, up to 0.5 marking you have to take the blood, okay. After that, you have to take the uh, diluting fluid here. You have to take the diluting fluid, okay. And you can also do the same things here also. You can take just 20 microliter of blood, and you can take 4 ml of RBC diluting fluid here, okay. And whenever the dilution will be happening, then you have to take with the RBC pipette. Got it? Whenever the dilution should be happening, then you have to take it through the this pipette, okay. You can also do this one, or you can also do the dilution here also. Okay, and after that what will you do? You have to just take it from 101 marking. After that you have to just shaking it properly, and after that you have to just touch this pipette here. Got it? Just touch this pipette here, and that will be automatically sucked by this newer counting chamber, and that will be automatically sprayed into this newer counting chamber. After that, just fixed a cover slip here. Okay, that is cover slip, that is you have to fix here. After that, into the microscope you can see this kind of small box, okay, or the small square. Here is present basically 1 2 3 4 5 6 7 8 9. Here will be 9 square. Got it? 9 large square, and it is divided into 25 medium square and 16 small square. Okay, and there will be present 16 small square in each. Got it? And you have to find out the middle area, and into the middle area you have to mark by your own eye. Okay, don't buy any kinds of paper or anything else. And there will be 5 position: last one, last one, last one, last one, and middle one. Got it? I am zooming here, it will be helpful for you. See, I am zooming these things again. See, what will you do? You have to just charge this blood. Okay, that is a mouth pipette, mouthpiece. You have to just suck it. Okay, then you can do just insert here, and you have to just release the pressure. Then the blood will be automatically sprayed into this newer counting chamber. Okay, and after that added the cover slip. Added a cover slip here. Just added a cover slip here. Then under the microscope, 40x microscope, you can see there will be various type of square. Got it? And there will be present into the middle square, there will be present basically one last, another one last, one last, and one last, and side, and there should be one middle position. Okay, you have to just count these five square. You have to count how many number of RBC are present. There will be no color formation. Every RBCs are look like same color. There will be no color formation. The color should be white or gray like color. There will be no color development. Okay, without color, just like looking white or anything else. Okay, there will be no color. Just keep in mind that no coloration are happening here. Okay, just you can see these are, these are, these are, these are, these are. Okay, and n is equal to n1, that should be n1, that should be n2, that should be n3, that should be n4, that should be n5. So that n1 should be 1 plus 2 plus 3 plus 4 and plus 5. How many number of RBC you can see here? You just calculate it. Okay, under 40x you can see like that. See here, under the 40x you can see like that, 1 square. Got it? 1 square should be like that. Okay, see here, I am just zooming this round formation here. Got it? That is the this one. Got it? So that you have to count this one, this one, this one, this one, and this one. Understand it? I am just zooming this square here. You can see you have to count this one, A, B, C, D, and E. Got it? And after that, just accumulate it properly. And here I am zooming the another one. Here I am zooming only one square. Only one square. You can see this one. Understand? Under 40x. Okay. And the methodology should be like that. You have to just scrolling your microscope through the knob or through the chorus adjustment knob. You have to just adjust your microscope into the online. It's not possible, so that you can just move this up sidewards, after that downwards, after that again the leftwards, after that again the downwards, after that again the rightwards, after that downwards, after that leftwards. Got it? And you have to count it, and without practical it's not possible to saying you properly. Okay, just doing the practice into your laboratory, but into the diagnostic laboratory that is not possible. Into the academics it's possible. Okay, into the academics that is possible. See here, here is the calculation. Okay, the calculation should be number of cell in 5 square. I have already told you that number of cell into the 5 square, 1 square, 2 square, 3 square, 4 square, 5 square. After that, into the dilution number is 100. After that, into the reciprocal number of volume, dilution number, here you can see dilution number is 0.5 is to 100, so that we can see that that should be 200, that is the dilution number, and reciprocal number of volume that should be 50, and you will get the RBC count should be n into 10,000. Got it? You just remember this thing, don't require to understand the calculation. Any kinds of examination they are not asking about the calculation. You have to just remember this shortcut methodology, n into 10,000. Got it? N means 1 2 3 4 5, 5 square, you have to just sum this 5 square, after that into 10,000. Okay, that is the number of RBC, and that is the important question, the dilution. What will be the dilution? Got it? What will be the dilution? It is also an important question, you have to keep in remember that. And one thing you can also do, if you want to doing the dilution here, you can do one thing, that I am saying you that you can do one thing, that you have to take 0.5 mark blood, okay, red blood cell or whole blood. After that you can take up to 101, up to 101 you have to take the RBC diluting fluid or Hims fluid. After that you can just shake it properly and just giving the dilution here, and just giving the dilution here into the Neuber counting chamber. Got it? You can also do that. Okay, same. Anyone have any problem? And just keep in remember that n into 10,000, that is the important thing, n into 10,000, and you have to measure 5 small square. Got it? 5 small square. Into the RBC counting, there is the first question should be which fluid you are using, Hims fluid. Secondly, the dilution should be 1 is to 200, and thirdly, how much square you have to count, that should be 5. Okay, and fourthly, what are the calculation, n into 10,000, you can say. That is the manual methodology. Semi, if anyone have any doubt.
No, sir.
Okay, very good. Anyone? But nowadays it's not are using any kinds of laboratory. Keep in mind that nowadays it's not required to just doing into any laboratory. Nowadays the automated machine is already installed. I think that into the some kinds of academics laboratory they are also uses the automated machine, because it takes lots of time. If you are doing only RBC count and taking 1 hour or 2 hour, it is possible. Into the patient it is not possible. Okay, so that it's only for academics, it's only for your knowledge, it is not required for any kinds of your diagnostic purpose. Okay, but I have to say you, because there have some questions, so that we have to understand it properly. Okay, after that, see here is the automated method. Nowadays it's uses automated method, that we can say that hematology analyzer, right? Basically the Sysmex is too much widely uses. I have seen lots of laboratory, they all are using Sysmex, right? Sysmex, that is that have 5 parts Sysmex and 3 parts Sysmex, right? 3 parts and 5 parts. Same, what are the difference between the 5 parts and 3 parts? I have already asked this question in the previous classes. I think that previous classes or any another classes, because I have taken lots of classes, I forgot that in which classes I have asked. Same, what is the difference between the 3 parts and 5 parts?
In 5 parts, all kind of WBCs are counted. In 3 parts, neutrophil, lymphocyte, and mixed cells only counted.
Very good. In the 3 parts, there is only granulocytes are counted, right? But into the 5 parts, every WBC are counted. It is also the important question for your exam aspect or for your interview aspect or anything else. Okay, it is also an important question, you need to understand it. Okay, three parts basically gives three parameter of WBC, that is neutrophil, eosinophil and basophil, and five parts gives lots of number of WBC. Okay, lots of number means there is only five number, that's lymphocyte and monocyte, they are all are the basic. Semi, why we are saying a granulocyte? What do you mean by a granulocyte? What is the terminology? Agranulocyte. What do you mean by agranulocyte?
মানে যাদের অ্যাবসেন্ট থাকে তাদেরকে
Very good.
একজন
Very good. Where the granulocyte is absent or granules is absent, right? We are saying that agranulocyte. A defined as absent. A for apple, not A for absent. Okay. See here. Here is a automated method for hematology analyzer. Firstly, the equipment should be automated, that is Sysmex, that can be three parts and that might be also the five parts. Okay, what will you do? Loading the sample, place the blood sample into the analyzer. After that process should be analyzer uses based on the electrical impedance or laser light scattering to count the RBC. Anyone have any idea regarding flow cytometry? Flow cytometry, anyone can listen? Flow cytometry, what is flow cytometry? No idea. Flow cytometry? Okay, no idea. See here. Flow cytometry is a mechanism. I am just saying you not briefly because flow cytometry also required one classes, because flow cytometry is under advanced diagnostic tool, ADT. Flow cytometry is under advanced diagnostic tool. And there is chromatography. Yesterday I have discussed about the chromatography, electrophoresis, flow cytometry, they all are the advanced diagnostic tool. I am just saying you little bit about the flow cytometry. See here, flow cytometry is the mechanism where the light source should be present, got it, and the light source are giving the light, and there will be one tube like structure. Whenever any kinds of cell are passing this tube, and there will be some fluid, there will be some buffer, and that is the whenever I will discuss the flow cytometry too much briefly, then you can understand that, though it's not your part. And there will be a detector, got it, there will be a detector, and there have light. Whenever the lights are come, and there have also light, okay, they basically doing the another things. See here, whenever any cells are passing, then these lights are giving, and whenever the lights become blinking, then it gives the count. Okay, then it gives the count how much RPCs are here. But how much is density, it will defining by, see here, just I am erasing this one. Basically flow cytometry gives three things. One is how much the count of any cell. Secondly, how much the density of this cell. Thirdly, what are the structure of the particular cell. What are the structure means, is it normocytic, is it microcytic, is it macrocytic, this kind of, these three things basically flow cytometry given. If I am explaining these three things, it will take full classes, so that I am erasing the things, and there is a full mechanism, it requires lots of time. Okay, one part will give you the count, one part will give you the density, one part will give you the granulosity means density. If it's granules present, then the cells become dense, right? If the granules is not present, then the cell become not dense, right? Because granules give the concentration, got it, and how much or how it look like, what about the structure of the particular cell, it will gives also one part. Okay, basically that's all about the flow cytometry. This flow cytometry sometimes uses into this process, that is a laser light scattering, that is also one type of things like flow cytometry. Okay, and after that it measures the RBC size. I have already told you that, right? Size. Secondly, I have already told you the shape. Is it macrocytic? Is it microcytic? Is it normocytic? Right? And the hemoglobin concentration I have already told you here. See, there is the three things. Okay. Hemoglobin concentration means, is it hypochromic? Is it hyperchromic? Or is it normochromic? Normochromic means normal color or normal hemoglobin level. Got it? And the result displayed is also RBC count giving, MCV giving, hemoglobin concentration giving, hemoglobin concentration MCHC, right? Mean corpuscular hemoglobin concentration. Advantage, it's a rapid and highly accurate. And second thing is, it gives the result too much easily. Fourth thing is, here does not require too much manpower, right? And last one is the provide the additional details like red cell indicates, right? MCV, MCAC, MCH, they all RDW, they all are given by the automated method. But into the manual method, is it possible to calculating MCV, MCH, MCAC? You need to require the calculation. I will take the another classes for MCB, MCAC, or this kind of things. Whenever I will discuss with you, then you can easily understand it. Okay, say me up to this much. If anyone have any problem, that is the sysmax. I don't know which part is it, because there is not mentioned the parts name. That can be 3 part, that can be 5 part. Into the automated method, that is also easy, because you all guys have already done this kind of CBC count, because into the laboratory it's one of the easiest work, right? Just insert the EDTA file here, just insert the EDTA file here and just tap the button. Okay, and you will display the result here. After that, you can see and you can take a paper from this output. You can take the paper. After that, go to the hematologist. If any kinds of WBCs are abnormal, if the WBC is kind of high or low, they are just taking a red pen and just write it through the DLC count into the big laboratory. They are not giving the automated result, as well as they are not depending upon only automatic result. After that, they can do the DLC if anything wrong, or if the hematologists are thinking that some kinds of WBCs are high or some kinds of WBCs are low and some result are abnormal, they are just cross it and give the right result, and just do a signature of the hematologist, and the report should be extracted out and we can leave the report. Okay, that is the automated procedure of RBC count. Not only RBC count but also CBC. Okay, here you can see the chart. Yes,
Chromatography
yes.
তিনটে যেটা পার্ট, chromatography, flow cytometry, আরেকটা কি?
Electrophoresis. Yes, and chromatography, there have also lots of chromatography: thin layer chromatography, paper chromatography, ion exchange chromatography, high pressure liquid chromatography, HPLC. And electrophoresis, there is also lots of type of electrophoresis, like gel electrophoresis, thin layer electrophoresis, silica gel electrophoresis. Okay, there have also lots of type of electrophoresis. Electrophoresis is required for separation of the protein. Electrophoresis is required for separation of the DNA, and electrophoresis is required for the separation of RNA. Got it? And this kind of flow cytometry is required for counting the cell, for identifying the cell shape, for identifying the cell size. Okay, that's all about the application of this advanced tool. Just look down upon here. What are the definition? If it's, see here, if the condition is high, that is called polycythemia. If the condition is low, that is called anemia. Got it? Definition here is a RBC count should be higher than normal. Understand? And the low level RBC count should be low. Okay, then normal. Got it? Polycythemia, the causes is of polycythemia, chronic hypoxia. Say me, what do you mean by hypoxia? Just one second.
Oxygen,
Very good.
মানে
Low
oxygen
level of oxygen. Low level of oxygen, right? After that, here is a nutritional deficiency. If vitamin B12 or iron is required for formation of hemoglobin, right? Iron is required for formation of hemoglobin. So that if the iron are not proper, then we can say that anemia are happening. If the anemia are depend upon iron, or if the anemia are occurring due to lack of iron, we can say that iron deficiency anemia, right? If the anemia are occurring due to lack of vitamin B12, then we can say that vitamin B12 deficiency anemia, or we can say that pernicious anemia, right? Okay. And after that, into the dehydration condition, into the smoking condition, into the high altitude, then what which kind of things are happening? Then the RBC level become high. Okay. After that, into the blood loss or chronic disease, then RBC level become low. After the symptoms, basically headache, dizziness, red skin, and this kind of symptoms may occur into the polycythemia, and into the anemia, fatigue, pale skin, weakness. These kind of symptoms may occur in anemia. Got it? And last one is the treatment or management. Treat the cause, phlebotomy if required. Okay. And supplements, iron supplements or vitamin B12 supplements you can give to the anemia patient. That is the short term treatment. Okay. And short term management, because the treatment part is not under our hand, as well as treatment is not our part, so that we are not discussing about the treatment. We have to just identify that is the polycythemia or anemia, or the RBC shape is normocytic or normochromic, or macrocytic, microcytic, or any kinds of abnormalities are happening into the RBC shape or not. We have to just identify it. Okay. Semi, up to this much, any problem? Up to this much, any problem?
No, sir.
Amit, very good. Brotin, no
এবার
problem.
রিপিট করলে ভালো
No,
হয়
sir.
Go, it is
স্যার
not.
রিপিট করলে ভালো হয়
Which topic I will repeat. I have already told you everything. Just write it down. I will solve you into WhatsApp. Is it possible to repeating everything? I have
বলছি
already told
থ্রি
you
পার্ট
about RBC. Say,
থ্রি পার্ট থ্রি পার্টস ফাইভ পার্টস এর ক্ষেত্রে ইলেকট্রোফোরেসিস এর মেন কাজটা কি?
electrophoresis there does not require. There is a flow cytometry required.
এখানে কি শুধু ফ্লো সাইটোমেট্রিটাই ব্যবহার হচ্ছে 3 and 5%?
Flow cytometry or laser light scattering.
Chromatography.
No, it's not chromatography. Laser light scattering. Laser light scattering means here, into the innermost portion of the machines there is uses some light. This light are connected with the detector. When any cells are passing into this light, they are giving the detector that 1. If the second cell are passing, then the detector giving the 2. Got it?
বাট ইলেকট্রোফোরেসিসটা এখানে কি মানে
Yeah, does not require any kinds of electrophoresis. Electrophoresis is the separation technique.
ওকে সেপারেশন।
Electrophoresis is separation technique. Electrophoresis is required for separation of protein, for separation of DNA, for separation of RNA, for separation of any protein fragment, for separation of the any unwanted molecules which is present into your blood or into your any other sample. Got it? Semi, anyone have any problem?
সিবিসির সাথে ইলেকট্রোফোরেসিসের তো কোনো সম্পর্ক নাই, ওইটাই বলতে চাইছি।
No. There is a little bit relation with flow cytometry. Little bit relation, not full-time relationship. Little bit. Okay. We have to move the platelet count. Okay. Semi, if platelet become high, what is the condition? What will be the condition?
Thrombocytosis.
If it's low,
Thrombocytopenia.
Thrombocytopenia.
in which condition we can see the thrombocytopenia?
Dengue.
ডেঙ্গু।
Why the thrombocytopenia are occurring into the dengue?
ডেঙ্গু হলে প্লেটলেট কমে যায়।
I understand, madam. I understand. Dengue, whenever the dengue are occurring, platelet become decreases. So why the platelet become decreases?
Dengue viruses affect the platelet production bone marrow.
Very good. That is the right answer. And Semi, in RBC WBC, where RBC WBC RBC WBC formation are occurring? Bone marrow, right?
Bone marrow.
Bone marrow.
And whenever the cells production are happening, that might be red blood cell, that might be WBC, that might be platelet. What is the terminology we are using? Hemopoiesis? Yes or no?
Yes, sir.
And if RBC production are happening,
Erythropoiesis.
if leukocyte formation are happening,
Leukopoiesis.
if platelet formation are happening,
Thrombopoiesis.
Thrombopoiesis.
what is the early stage become platelet? That is platelet, right? What is the early stage become platelet?
Megakaryocytes. Megakaryocytes.
Very good, megakaryocyte. What is the early stage before RBC?
Reticulocytes.
Very good,
Reticulocyte.
immature RBC. Immature RBC, right? Reticulocyte. Is reticulocyte there is a nucleus present? Is there nucleus present in reticulocyte?
No, sir.
Remnants of RBCs.
What? Alex, say me.
Remnants of RNA sense.
Is there nucleus present in immature RBC? In the mature RBC, nucleus present or not?
Not, sir. It's an,
Into
not.
the immature RBC, there will be little bit nucleus, not fully erases. Okay, the size should be small. Okay, see here. Just look down upon the erythropoiesis properly. Okay, see here. Platelet, that is a very basic definition that we are saying that plate thrombocyte, which is essential for the blood clotting. Got it? That is very basic things. What are the normal range of platelet? You might say that 1.5 lakh to 4.5 lakh per microliter of blood. Got it? See here. Function of platelet help to the stop bleeding by forming of the clot or clot formation are happening. Secondly, may a role in wound healing. Wound healing means whenever any kinds of hemorrhage are happening, then platelet help to clotting the blood of the particular site. Got it? And maintaining the vascular integrity. Semi, what do you mean by vascular integrity? Any idea? No.
No idea, sir.
Got it. Vascular integrity means maintaining the blood vessels blood flow. Got it? If any kinds of disorder of vascular integrity are happening, then clot formation may form. Here clot formation may form. Here clot formation may form. Thus, platelet maintaining the vascular integrity properly. Okay. What are the purpose of measuring the platelet count? Diagnosis the bleeding and clotting related disorder. Whenever I told you the whenever I have taken the class related to bleeding and clotting time, I have already discussed the thing. Monitor the thrombocytosis or thrombocytopenia. Okay. After that, to effect of medication of affecting the bone marrow, if any kinds of medication we are taking to just a recovery of the bone marrow, then it platelet count help us to understand it properly, evaluate the risks before surgery. Okay, the before surgery we can measure the platelet count, is it proper or not. Okay, see here, there is a automated methodology that is also same like RBC. There is no other things that is also same like RBC, sample loading, measurement. The machines use a light scatter. Here you can also say that, see that light scatter. Okay, or fluorescence to count the platelet. There have some fluorescence mechanism also, and their size mean platelet volume and platelet indices such as platelet distribution wide are also calculated sometimes, but into the normal report you will not get this result. You will get only RTW. Have you ever seen the platelet distribution width? No. We can see, and we can basically saying, or we can basically measuring the RDW, not PTW. This RDW means the red blood cell distribution width, means how much area are covering through the RBC, as well as how their distribution, is it too much high or is it too much low, How that distribution means how they are situated. Is they are situated into closely? Is they are situated very much longly? Is they are closer to each other? That is called distribution width. Okay, and whenever we are doing the same things on the aspect of platelet, we are saying that platelet distribution width. Got it? And that should be digitally in 1000 per microliter. Okay, and advantage is fast and highly accurate and detect the platelet clumps and size of abnormalities. And into the automated machine there have also some kind of disadvantage. Firstly, if any kinds of cell become clamp, they can count that, that is number one. And they can count that whenever any kinds of cell are clamping to each other, they can count that that's one cell. Okay, they can count. We will not able to understand that is they're counting it properly or not. That is the main disadvantage. Second disadvantage is it if the hemolysis are occurring, then your machine will count various number of WBC or RBC, right? If the RBC become distracted, if the RBC distraction are happening, and if the distracted part are taking the another step, they might count that the RBC that is also RBC. Okay, so that the RBC count will be in cases. That is also second number of drawback. And third number of drawback is basically sometimes they are not detecting the size properly. That is also a drawback. Okay, that's all about the drawback of automated machine. See here, that is important question. That see here, dilution 1:20 into the RBCs. What was the dilution? Say me, what was the dilution into the RBC?
1 is to 200.
1 is to 200.
Very good, 1:200. The blood is diluted in filtered solution of 1% ammonium oxalate. Got it? What will be 1% ammonium oxalate? Okay. After that, uh, it lyses the, here you can see the principle. When the blood is diluted with 1% ammonium oxalate, how much amount I will say you. Okay. After that, it can help this ammonium oxalate basically lyse the RBC. Got it? So the RBC become lysis. There will be remaining present only RBC, WBC and platelet. Got it? But we are just only detecting the platelet, or we are only counting the platelet, or we are counting the platelet formula. Then we can say that we are taking only platelet. Got it? This ammonium oxalate basically lies the RBC. So there will be only WBC and platelet, but we are not using the application of WBC. We are only using the application of platelet, or we are only measuring the platelet, or we are only counting the platelet so that we can easily take the platelet level. Okay. Have you understood these things?
Yes.
Very good. Please take some water. Okay, here. What will you do? Just mix the blood carefully with 0.38 ml of filtered 1% ammonium oxalate. Okay, into the clean glass tube. I have already told you that. And added 20 microliter of blood. Got it? 20 microliter should be blood, and there should be 0.38 ml. There should be 0.38 ml of ammonium oxalate. Okay, just mix it properly and leave it 3 to 4 minutes so that RBC can lyse. Okay, if we are mixing it properly, then RBC become lyse properly. Okay, after that, assemble and clean the counting chamber. We have to count. Same newer count chamber here we will also use. There is no differentiation of newer count chamber. Okay, same counting chamber we will also use. After that, to prevent the uh, drying of charged fluid, means you have to keep in remember that if any kinds of drying are occurring into the charged fluid or not, and chamber with humid container 15 to 20 minutes, we are just giving the chamber and allow for resting time for settling down the platelet properly. See here, here we are using this kind of pipette, measure 0.4 ml of 0.4 ml of ammonium oxalate. After that 0.02 ml of, then remove 0.02 ml. Got it? So that we will get 0.38 ml. It is not possible to using this pipette and getting this amount, so that we have to just take in 0.4 ml. After that we have to just remove 0.02 ml. Okay, or 20 microliter, we have to just erase it. After that we will get 0.38 ml. Got it? That is the ammonium oxalate. After that, see here, that is the ammonium oxalate. After that, that is also same like RBC. That is WBC means WBC. Whenever I will teach you the next day WBC count, then you will understand it. This four square we have to count for WBC. Got it? This four square. But for RBC and for platelet, we have to count this five chamber or this five square. That is also the same like RBC. That formula is different, but after taking, I'm just using here, see here, just taking the pipette here, that is same like RBCs, taking the pipette here and just charged here and placed a cover slip properly. Okay, and after that using the microscope, then you have to count this one, this one, this one, this one, this one. Okay, okay, you will see this under microscope. Okay, whenever you will see the microscope, then you will see this kind of square, it already present. Okay, and what will you do? You have to count n is equal to 1 plus 2 plus 3 plus 4 plus 5. Okay, and you will get the total platelet. Okay, after that we need to understand the calculation. Here you can see the number of thrombocyte counted into dilution. Okay, by area counted into the depth of the fluid. See here, the dilution should be 100. After the area counted, that will be 4 into 1, that is 4. After the depth is 0.1. Okay, after the, what will be the count? Just keep in remember that number of thrombocyte into 500. Okay, 500 not 5000, n into 5000, that will be the number, or that will be the count, platelet count. Got it? Don't require to understand this kind of formula, because every sites or every book will give you the another formula they are using into their own aspect. You can also take it, or you can also do it by your own self. It is a too much easy thing. It is one type of just calculation. They require some kind of math, and whenever we are teaching into the board, we are just using the some maths here. Okay, and we can get it too much easily. Okay, that is a calculation. So that up to this much RBC is equal to, keep in mind that n into 10,000, right? And platelet should be n into 5,000. Got it? Tell me if anyone have any problem. Platelet should be n into 5,000 and RBC should be n into 10,000. Okay, that is the calculation of platelet count and RBC count, and you can get it nowadays into through the CBC. Through CBC, you will get every parameters through CBC. Nowadays, it's too much easy as well as too much advanced systems.
এটা 1% অ্যামোনিয়াম অক্সালেট ইনটু থিন গ্লাস টিউব, যেটা বলছে 0.38%, তাহলে কি বুঝতে পারলাম না। এই তো মানে 20 মাইক্রোলিটার ব্লাড স্যাম্পেলের সাথে 1% অ্যামোনিয়াম অক্সালেট মেশানো হচ্ছে।
1% ammonium oxalate is the solution. You have to
এটা
take 0.38 ml of ammonium oxalate.
ওকে 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 বুঝেছি।
1% is the solution. 1% ammonium oxalate. So that into the RBC, which fluid we are using? Heme fluid, right? It is important to understand the composition of heme fluid. I am searching here. Just see here. Composition, because it's composition of heme fluid. RBC count. Just look down upon the whole MCQs. I will give you the MCQs in whole count. Okay, that should be RBC, that should be platelet, that should be What is the heme solution is the, see here, composition of RBC diluting fluid. See here, there will be present sodium sulfate, glacial acetic acid, and distilled water. Okay, they are the ingredients of Gravar's solution. That is also the same. Okay, into the heme solution, that is also the same. That you can use as the heme solution, or you can use as the Gravar's solution as well. Into the heme solution, here you can see mercury chloride, sodium sulfate, sodium chloride, distilled water, and phenyl. Sorry, phenyl not. That is the final pH 25 degrees centigrade. Okay, that's all about the composition of Hames fluid. Okay, sometimes it's asked, sometimes. Okay, semi. If anyone have any problem, here you can see the dilution should be 1 is to 200. Got it? The dilution should be 1 is
নর্মাল
to 200.
ল্যাবে নিউবার টেম্পারেচার এখন উঠে গেছে। নর্মাল স্লাইডে কটা ফিল্মে কিভাবে হিসাবটা হয় সেটা
N into 10,000. N means you have to count 5 number of the whole square. 5 number means one number, one square should be like that. See here, just that is one square, that is one square, that is one square, that is one square, that is one square. Got it? Whatever you are getting the whole RBC, that should be N, the sum of these 5 square. After that, whatever you are getting like 5,000, no, 5,000 not, you will get like 500 or 100, 200. After that, into 10,000. Got it?
ওকে। বাট নর্মাল স্লাইডে কটা ফিল্ড গুণে আরবিসিটা মানে আরবিসি তো থাকে প্রচুরই
Into the
এরকম
normal
ভাবে।
slide, it is not possible to counting RBC. That is not possible. There are lots of million of RBC. Into the normal slide, it is not possible. Into the normal slide, we can measure the WBC. Whenever I will take the class WBC count tomorrow, I will discuss with you.
ওকে।
Okay, we
আর
cannot measure, we cannot
প্লেটলেট
see.
প্লেটলেট নর্মাল স্লাইডে প্লেটলেট নিয়ে
No,
তো স্যাররা বলেন।
we can see the number, or we cannot see the exact number of platelet. We can see the platelets are few in number, the platelets are high in number. We cannot see the exact number, or we cannot see the exact number of platelet. Is it possible 1.5 lakh to 3 lakh count through our naked eye? Is it possible? No. Into the normal slide we
এটা
cannot count, but into the neural count chamber we can count.
মানে প্লেটলেট আরবিসি নর্মাল স্লাইডে করা যায় না, কিন্তু স্যাররা নর্মাল স্লাইডে প্লেটলেট কাউন্টিং করে দেখেছি। মানে ডেঙ্গু পেশেন্ট থাকলেও তার
that
প্লেটলেটটা
is the that is the assumption. That is not the count. That is the assumption. The platelet are low in number, platelet are high in number, we can say, but we cannot say through the naked eye how much platelet is present. Got it? Your sets are doing these things after getting the result or after getting the report, and after doing one slide, they can see, and I can also say the platelet number is low, platelet number is high, but I cannot say how much number of platelet are present here. Just ask them
Yes, sir.
how much number of platelet present. Ask your teacher. Okay.
ঠিকই বলেছেন, ওই রিপোর্টের কপিটা দেখে লেখে স্যারেরা।
That is right. After getting the reports copy, they can evaluate is it
Yes, sir. Yes, sir.
possible or not. Just ask your
হ্যাঁ,
teacher.
আমাদের কলেজেও হয় সেম।
Just ask your teacher, is it possible to seeing the naked eye how much number of platelet is present?
যখন
প্লেটলেট
স্লাইডটা স্যার পাঠানো হয়, তখন ওই সিসম্যাক্স এর প্রিন্টেড কপিটা
After
এবং
that,
রিকুইজিশনের
they
ফর্মটা
are just
একসাথে দেওয়া
writing
হয়।
these things, or they are just wronging these things. They cannot see
হ্যাঁ,
into naked eye, and they cannot
yes, sir.
give the final report, and they cannot just give you the initial report. They can give you the final report, they cannot give you the initial report. Is it not possible? It's
তাহলে
impossible.
তাহলে
সেপটা
একটা
লেখে
কথা বলি,
সেপটা।
Yes,
একটা কথা বলি।
sure.
আমি রিসেন্টলি একটা ইন্টারভিউতে গেছিলাম, ঠিক আছে, আসানসোল। তো সেখানে আমাকে একটা স্লাইড দিয়ে দিল, বললো এই স্লাইডটাতে প্লেটলেট কাউন্ট, এই স্লাইডটা থেকে মানে টোটাল কাউন্ট, ডিফারেন্সিয়াল কাউন্ট অ্যান্ড প্লেটলেট কাউন্ট আর এমনি একটা পেরিফেরাল ব্লাড স্মেয়ার করতে বলেছিল সেটা। তাহলে আমি সেখানে প্লেটলেট কাউন্টিংটা কিভাবে দেখবো এবং
You
অয়েল
have
ইমার্শনও
to say that through the through the blood smear platelet count is not possible. Sir, I can say the I can say the assumption the platelet is high or low. I cannot count the platelet. I can only do the differentiate leukocyte count. Only for the differentiate leukocyte count we are doing smear. We are not doing smear for counting the RBC, for counting the WBC. You will never see.
সেটাই।
Okay.
আমরা তো নিউবার চেম্বার পড়েছি কলেজে, তো সেইভাবে আমরা মোটামুটি জানি। আর সিবিসি দেখে, রিপোর্ট দেখে আমরা ওটা
Sure.
ওভাবেই করি, কিন্তু
Sure.
আমার সেরকম ভাবে প্র্যাকটিস নেই। তো সেভাবে বললাম, তো ম্যাডাম আমাকে বললেন যে না, এরকম ভাবেই আমাদের তো এই ল্যাবে এরকম ভাবেই করতে হয়, তো এরকম ভাবেই মানে আমরা করি, মানে
Every
তারা
lab have
বলতে
their
চাইলো।
every
তো
lab have their own protocol, but it's not true. It is not possible. So that you can search it in Google. You can search it in Google. You can search lots of books. There is no procedure to blood doing the blood
Yes, sir. Yes.
smear. There is no procedure to doing the blood smear for counting red blood cell and platelet. That is
Sir,
only for differentiate leukocyte
adequate,
count. Okay.
sir, adequate কথাটা লিখে আমাদের কলেজে।
Exactly,
প্লেটলেট
exactly. Platelet is
adequate.
adequate. I can also
হ্যাঁ,
say
yes,
you
sir.
the platelet is
হ্যাঁ, yes,
adequate.
sir.
I can also say you the lack of platelet, but I
Yes, yes,
cannot
sir.
say the number of platelet. I cannot say you the count. You have to giving the answer to your madam confidently. Okay. If you are confident,
সেটাই
they will confuse. If you are
আমি তবু
if you are facing lack of confidence, they will ask you another
এটা
question. But you have to give the
আমি
answer
বলে
confidently.
আমি তাকে বলেছিলাম যে এরকম আমরা তো নিউবার চেম্বারে করেছি কলেজে, এবং আমাদের হসপিটালে যেখানে আমি এখন ইন্টার্নশিপ করছি সেখানে তো সিডিসি মেশিন আছে, 5 পার্ট 3 পার্ট, ওখানে দিয়ে আমরা যেটা অ্যাবনর্মাল সেটা দিয়ে আমরা স্লাইড করে
Exactly.
দেখি। স্মেয়ার টেয়ার সবই করতে পারবে, কিন্তু ওরকম ভাবে কাউন্টিং করতে তো অবশ্যই না। টোটাল কাউন্ট কিভাবে করবো?
No, no, it's
একটা
not
হচ্ছে
possible. It's not
এবং
possible.
সেই টাইম আমাকে বেঁধে দিচ্ছে, মানে 10 মিনিটের মধ্যে আমাকে।
ডিএলসিটা পসিবল।
It's not possible. Okay. Just say them. It's not possible. Every lab have their own protocol. They can ask you lots of questions.
মোটামুটি
Can I
করেছি,
say
ঠিক
something,
আছে।
sir?
Yeah, Amit. Obviously, say.
सर एक्चुअली मेरे पैथोलॉजिस्ट जो है सर ना, वो स्लाइड देख के सर काउंट बताते हैं। उनको कभी हम रिपोर्ट नहीं देते सीवीसी का सर। वो एग्जैक्ट मोस्ट प्रोबेबली
Everything.
10,000 या 5,000 का डिफरेंस होता है सर।
Yes. That is not exact. That is the experience. That is depend on
बट
experience. ठीक है ना अमित? वो
यस
जो
सर,
एक्सपीरियंस पैथोलॉजिस्ट
यस
है,
सर, बट ना
वो जो
यस
एक्सपीरियंस है,
सर,
हम जब देखेंगे ना, हम जब एवरीडे स्लाइड देखेंगे, हमको एक एक्सपीरियंस हो ही जाएगा ना। सम काइंड्स ऑफ पैथोलॉजिस्ट दे कैन इजीली आस्क द दे कैन इजीली सी थ्रू द culture method or through the culture, what can I say, culture plate. They can easily say the bacteria's name, they can easily say the symptoms name, but it is not possible. It's required experience, right? Lots of
यस सर।
एक्सपीरियंस लोग ये कर लेते हैं, ठीक है, बट एग्जैक्ट नहीं है, ये एक एजम्पशन है, राइट अमित?
यस सर,
ठीक
बट
है ना?
वो यस सर, एग्जैक्ट ये सही है, बट जस्ट लाइक मैंने आपने बोला ना सर कि जैसे टोटल काउंट करते हैं, डीएलसी डिफरेंशियल करते हैं सर। तो जैसे डीएलसी का शेप देखते हैं, साइड देखते हैं, तो अलग अलग डिफरेंसेस में भी काउंट करते हैं कि ये इस्नोफिल है, बेसोफिल है, न्यूट्रोफिल है।
ऑब्वियसली
यस सर।
डीएलसी काउंट बहुत ही आसान है, डीएलसी काउंट कर लेते हैं, डीएलसी
बहुत
काउंट
आसान है,
रेड्यूस
बट
है।
लेकिन जस्ट लाइक ये सब प्लेटलेट काउंट ना, वो मार्किंग काउंट करते हैं, 1 2 3 4 एंड मल्टीप्लाई कर लेते हैं लोग,
रियली?
बस यही फाइनल रहता है उन लोगों का सर।
अंडरस्टैंड।
बट
इट्स
यस
assumption as well as ये जो शॉर्टकट मेथोडोलॉजी है, ये लैब में सभी लोग ये करते हैं, ठीक है।
यस
ये
सर।
तो शॉर्टकट है, ये जो एक्सपीरियंस तो बेस्ट है। जब
बट
जब
बट
कोई
ये भी
फ्रेशर
होता है ना सर, जस्ट लाइक ना आपने
लैब में जाएगा, इज इट पॉसिबल? जब जब कोई
नो
any
सर,
kind of student or any kinds of new technologies are going to the lab, is it possible to counting it? Because that is not methodology.
नो सर,
दैट इज नॉट मेथोडोलॉजी। तुम्हारा पैथोलॉजिस्ट का एक्सपीरियंस हो गया, उसके बाद ही ये कर लेते हैं।
ऐसा बट सम टाइम ऐसा होता है ना, बट सम टाइम ऐसा होता है जो मशीन का काउंट अगर 70,000 बिलो है सर, ठीक, बट जैसे क्लम्स आता है, आपने बोला ना प्लेटलेट क्लम्स, जैसे
मैं
क्लम्स आता है तो
मैंने
मशीन
तुमको
काउंट नहीं
बोला था
करता,
ना,
उसे सिंग
ओ क्लैम्प द
क्लम्स का
machine,
काउंट नहीं
machine
होता।
cannot count the clamp, machine will think that that is one platelet, machine will think that that is one RBC।
बट
होने पता
जब
क्लैम्प करो
बट
अपनी।
मेरे जो पैथोलॉजिस्ट जब मेरे पैथोलॉजिस्ट का कहना है कि अगर आपने एक क्लम्स देखा, वो नहीं 1 लाख प्लेटलेट आप इजिली दे सकते हो विदाउट
ठीक,
एनी हेजिटेशन, तो सर
यस
ये
यस,
एजम्पशन ही हुआ ना।
एजम्पशन ही हुआ।
Yes, sir.
मैंने तो बोला ये एजम्पशन है, ये एक्सपीरियंस्ड है, एजम्पशन है, ये कोई प्रोटोकॉल और प्रोसीड्यूर नहीं है। ठीक है ना
हाँ सर।
अमित?
उस
ठीक है।
उसके अकॉर्डिंग जैसे मैंने कितने बार रिपोर्ट कराया, पैथोलॉजिस्ट बोलते हैं आप ऐसे नहीं करो, वैसे नहीं करो, वैसे रिपोर्ट तो मैं ही करता हूँ, बट कभी कभी फंसा देते हैं सर। बट समटाइम तो ऐसा नहीं होता। बट अब उससे ना सर हम नहीं कर सकते, पैथोलॉजिस्ट सर से झगड़ा नहीं कर सकते, उनका बात
नहीं
मानना
नहीं नहीं
पड़ता है, हाँ
नहीं नहीं
ठीक है सर।
नहीं नहीं, उसका 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 रिस्पेक्ट करना चाहिए। ठीक है, झगड़ा वगड़ा मत करो।
नहीं
उसके
ठीक है
बाद
सर,
उसके बाद
नहीं सर
उसके बाद
ठीक है सर, बट ना मेरा कहना ये होता है कि सर आप भी एग्जाम कर रहे हो, मशीन रीडिंग दे रहा है, ठीक है सर, उसमें लार्ज सेल भी आता है सर, प्लेटेड लार्ज सेल। मैंने एक बार रीडिंग दिया था, अराउंड 70,000 आया हुआ था, ठीक है सर।
ठीक
मैंने
है
उसे
ठीक
काउंट करा, मैं खुद से काउंट करा था, मैंने एक बार चैम्बर से भी काउंट करा, तो अराउंड उसका 1 लाख, सॉरी 1,05,000 मैंने रीडिंग दिया था।
ठीक है ठीक है।
तो
ये
उन्होंने
ये
उन्होंने
बात
देखा,
बताओ बताओ।
उन्होंने ना सीधे 1.5 लाख दे दिया सर, उन्होंने सीधे बोला 1.5 लाख दे, तो बोले सर किस बेस पे आप दे रहे हो, मेरे को दिखाओ। मैंने स्लाइड बनाया था, मैंने यूनिवर्स से चैम्बर से
नहीं
चार्ज
नहीं,
करो, अब मेरे को
वो
करके
लोग का
दिखाओ।
वो
तो बोल रहे हैं कि
वो लोग का डिसीजन ही फाइनल है।